know what is the scope of family medicine. We should know what family medicine is. What is the subject like? Many people say that, oh, family medicine is similar to general practice. Why do you need a specialized training in that? But we must know that, are we getting properly trained in a particular subject during our MBBS graduation days? No, we are getting a generalized knowledge about everything. Similarly, the same as in case of family medicine also. Family medicine is a specialty. What is a specialty? What is a specialty? It is a broad specialty where you see patients of all age groups, right from the birth to the geriatric population, isn't it? So when you're seeing patients of all age groups, you are bound to see a lot of, not just the common illnesses, but also a lot of complications related to illness, a lot of problems related to their personal mental issues, the social issues, the community health issues. So a lot of things pertaining to particular individual as well as a family. And the most important thing what you should remember is, a family medicine doctor is not just a person who sees a patient or his family just for a short time. He provides a continuum of care. That is the most important thing which you should remember, which you should keep in mind, because he forms to be the first point of contact, as well as he provides a continuum of care to all the age groups. And that is from pediatrics to adolescent to adults and to the geriatric population. And it is not just a short time contact between your patients or your relation or your clients. It is a continuum of care and a continuous and comprehensive care what you're giving to your patient. So the patient, who will a patient prefer? Definitely a patient would prefer a person who is very close to them, not just keeping in mind that he can only discuss a few of his diseases with him. No, he would be very happy if he can discuss anything and everything with the person who he is very comfortable with, and that too being a doctor who he can, he or his family who can, reveal everything and be close to. Then who else is better than a family medicine doctor or family physician? Is it not? So he is one person. A family medicine doctor is a person who actually gives a continuum of care. He coordinates the activities. In the sense, there are times when certain amount of things may not be done from your point of view, where you need expertise care in terms of cardiology or neurology or endocrinology, any kind of other specialties, super specialties, subspecialties, orthopedics, anything. So you continue to be the main person in contact with the patient and the other specialties. Imagine a scenario where a patient directly goes to a specialist, super specialist or subspecialist. Imagine that condition, or imagine a scenario where he is indirectly in contact with you for a long time. You know him personally, his family, his background, his everything, and then he knows that you have connection with a subspecialist or in any other specialist, and how you coordinate the activities. He's had a fall at home. He's a geriatric patient. He had a fall at home, and suddenly they need a help, and then you coordinate the activities with them, and the patient gets treated in the hospital, and they come back again for a treatment with you, which is continued. So that kind of a connectivity between the patient, the specialist, and the three of you, that is best possible by a family medicine doctor. Then what are the other things? He not only sees a patient from the disease point of view, he sees a patient in terms of his mental illness, his physical aspects, his social aspects, his financial aspects. Moreover, this is a specialty where there is a good there is no other specialty where there is so much of importance for a hospital care as well as a community care. This is the only specialty where you can coordinate or you can do your practice in the hospital as well as in the community. You can shift or you can practice according to your time, your wish, and according to the convenience of the patient and yourself. So these are the main things which I must stress upon when I talk about family medicine. Then it is not only involving a patient per se, but a person as well as the whole family and the context of his family. So the approach towards these are the main principles and aims and objectives of family medicine. So the approach towards a patient is totally different from the other specialties. And I'm sure all these kind of things, even if we know it is not being stressed upon in your undergraduate level, whereas in family medicine, we stress upon these important points and make the postgraduates, learn and adopt these kind of practices in their daily routine. Can I have the next slide? Yeah, so just a picture to make you understand that family doctor is somebody who can take care of the whole family or the person, and he or she is always there for him from first to the last. Next slide, please. The main points in family medicine. So this is basically a primary care management. What is a primary care management? I'm sure most of us do primary care management, but then family medicine trains you to be specialized in a little more, in a specialist level than the undergraduate level, where you can handle a lot of cases, like you can do some of the practices. There are a lot of doctors who actually do, after doing the family medicine, they concentrate on maternal child health. Some of them concentrate on critical care, some of them in geriatrics, some of them in palliative care. So there are a lot of aspects where, according to your interest, you can turn your practice into. So primary care management can be lifted upon to a next level of a standardized healthcare when you are well versed with the family medicine training. And as I told you earlier, it is a person-centric care. Along with the person-centric care, you're not just involving the person, but also the family. And it's a comprehensive approach. It's a holistic approach. You're not just dealing with a disease. When a person comes with fever, it is not just fever, treating the illness or giving medications for the fever. You have in your mind what are the risk, the probable risk, or you search for the community, what are the other aspects which can lead on to these kind of diseases. A lot of things will come into your mind when you're actually trained into this kind of specialty. And specific problem solving skills, you will be able to achieve a lot of specific problem solving skills. And I must say that the community orientation or the social aspects of any kind of illness, or both pertaining to mental and physical illness, is important in terms of